good day to you all our viewers. So my name is Sancho, a fourth year medical student, and today I'll be sharing with you how to become a medical doctor in Zimbabwe. So for you to become a medical doctor in Zimbabwe, you need to be a holder of the MBChB degree, which is an undergraduate level degree, which means Bachelor of Medicine and Bachelor of Surgery degree. So it is basically a two-in-one degree. So this undergraduate level degree normally lasts for about 6 years in the new system. So previously it used to be around 5.5 years. So I'm going to give you a breakdown of what we will be studying up until you finish and become a qualified doctor. So your 6 years are going to be divided into the first 3 years are going to be your preclinical years, and the last 3 years are going to be your clinical years. So for the universities that are currently offering medicine in Zimbabwe, we have UZ with the largest recruitment that recruits about 300 students each year, and followed by NAST about 50 students, MSU about 25 students, and the recently opened one, Great Zimbabwe Universities. These are the four universities that offer MBChB degree. And with the new system it uses, that is the one that I'm going to break down to you so that you get to understand what we'll be studying and what's the process for you to actually become a licensed qualified doctor. For the first 3 years in the new system, it's called the biomedical science degree. After you complete this one, you actually tend to graduate. You graduate as a holder of the biomedical science degree. So in the first 2 years, you'll be studying anatomy, physiology. You also be studying behavioral science as well as biochemistry. In biochemistry, you only do it for the first year, but for anatomy and physiology, you do it up until second year, whereby you get to write your professional exams before you proceed to the third year. So in the new system, there have been additions and some modifications. So these are the courses that have been added to the system, where pharmacology, they were not there in the previous system of MBChB. We also have biophysics, heritage-based medicine, and you are also required to study one local language and one foreign language. So moving on. So after writing your professional exams second year and you pass, you proceed to the third year, and this is where you're going to learn pathology for 1 full year. So pathology is basically divided into 5 sections that are appearing on the screen right now. We have histopathology, immunology, chemical pathology, hematology, and medical microbiology. So it's basically a study of illnesses and diseases in the basic context. So once you've moved, after writing your professional exam for pathology and after passing your pathology and other courses that have been added as well, we have robotics, we have entrepreneurship, and you can also do a language if you didn't do a language in the first 2 years. And after passing this course, this pathology course after completing your 1 year, you now graduate and choose to go to do BDS, which means Bachelor of Dentistry and Surgery, and or you choose to do MBChB degree. So this is where we split. So a very few people will choose to do BDS, which is dentistry. And so for those who continue with MBChB degree, you actually in your fourth year you actually going to study medicine, surgery, and psychiatry. So as UZ holds a lot of students, so we're actually divided into groups to start the rotations, and the others will be doing psychiatry, and others will be doing surgery, and others will be doing medicine at the same time. But and you keep on switching, rotating. If you're doing psychiatry in the first semester, in the next semester you're going to be doing surgery, for example. So this is how the system operates. So after completing your fourth year, you now move on to your fifth year, whereby you're studying a one continuous block for 1 year. You'll be studying your community medicine, also known as public health, and obstetrics and gynecology, and your pediatrics. There are also other courses that have been added to enrich the program, including anesthetics, family medicine, as well as ethics and professionalisms that are also have been added during for the new system. So moving on to your sixth year, in your sixth year, you're actually going to be studying the four major courses that are there. We have your pediatrics, obstetrics and gynecology, obs and gyn. We also have medicine and surgery. So these are the big four programs that you courses that you'll be doing. So if you pass your clinical exams, you now graduate with your MBChB degree, and you now become a qualified doctor or a junior doctor. So after you become a junior doctor, you now do your 2 years housemanship or your 2 years internship at a teaching hospital, for example, Parinyato Hospital. Then during this time, you'll be working under supervision as well as but you are allowed to give diagnosis and prescription. After completing your internship as an intern, you now do your community service. So you can either choose to work in the provinces in Harare and work for 2 years, or go to the rural district and do your community service for 1 year. So after you have completed your community services, you are now a general practitioner. During this time, you are now allowed to move into the private sector or specialize. This is the part where you now can choose to continue working and or specialize right away in many of the specialties that are there. Thank you guys for watching. I hope you got an insight of what they do and what the steps that are required to become a medical doctor in Zimbabwe with the new system that is there.